Hey, what's up, guys? This is Dr. Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. And in this video, I'm going to talk about a very important topic that I actually discussed in one of my previous blogs that I didn't think enough people got a chance to really take a look at or read. So I just wanted to make a video for it so that more people can hear about this topic that I think is so important. In June 2019, I had a blog post titled, "Is My Doctor Experimenting on Me? A Black Man's Perspective." I chose to write about this because I've had many different patients on different occasions actually say that all the different tests and all the different treatments that we're giving them made them think that we're experimenting on them and we're trying to use them as a guinea pig. I recall one case where I had a African-American male. He was about 70 years old, and he came to see me for a routine office visit, and his blood pressure was elevated. And he came there with his daughter, and I said that, well, since your blood pressure is high, I think we should try you on an additional medication to see if that brings your blood pressure down. And he thought about it, and he was willing to try it because I suggested it. But then even his daughter stepped up and said, "I don't know why you want to try another medication, Dad. They're just experimenting on you anyway." And when I first heard this, I was actually kind of shocked to hear this, but then at the same time, I wasn't really, because I know about the history, especially for African Americans in this country, when it comes to medicine and their experience with experimentation. Many of you are probably familiar with the Tuskegee Syphilis Experiment, which took place from 1932 to 1972, so that was 40 years. And basically in this experiment, it took place in Alabama by a public health service, and it involved unsuspecting poor black male sharecroppers living in the South who were exposed to syphilis. They had treatment purposely withheld from them, and they were not aware that they had syphilis either. And basically what they wanted to do was they wanted to learn more about the natural history of the disease. They wanted to know more about what actually happens to you over time if you have syphilis and you don't get treated for it. So as a result, they ended up getting a lot of information about syphilis, but many men died from syphilis and many babies were born with congenital birth defects. So a lot of damage was done. A lot of men these days that are alive, especially, in the geriatric population, even in the baby boomer generation, this doesn't seem that far along ago for them. You can imagine that this is probably fresh in their memory, and I can understand why they wouldn't necessarily trust the medical field, or why they would have a mistrust of the healthcare profession in general. Even if you go all the way back to the 19th century, Marion Sims, who's often widely regarded as the father of modern gynecology, used to practice surgical techniques on enslaved black women without anesthesia, because he believed that black women didn't feel pain the same way that others did. And then in the 1950s, there's the story of Henrietta Lacks, who had samples of both cancerous and non-cancerous cells from her cervix extracted without her consent or knowledge to be used for medical research. And they're actually being used even until this day. Have you ever heard of HeLa cells? Those are actually cells that basically everybody in the country that does cancer research use in order to do their experiments, and they all come from her. And these are just the stories that we know about, and there are probably others. So if you can imagine, yeah, I can understand why there's a general mistrust of the healthcare profession by blacks. Okay, so let's go back to modern day with me, a young black man taking care of predominantly black patients from economically disadvantaged backgrounds. Am I pretentious to think that I can automatically just earn their trust because I look like them? After all, I'm just another talking head with a white coat, right? I'm prescribing Western medicines. I'm using all these different big medical terms. I try not to, but of course, I'm kind of like just part of the system. So it's not automatic that they're gonna trust me either. I have to earn that. But having said all of that, let me try to do my best in terms of answering the question of, are we experimenting on you? So the short answer to the question is, in a way, yes, we are, but let me explain. I'm gonna use an example of a common medical scenario. Let's say a patient comes to the clinic with 3 or 4 days of cough, and they're bringing up mucus, they have fevers and chills, they look pretty sick. Let's say I was not able to actually get them a chest x-ray right then and there. In many cases, a lot of doctors would actually just give them an antibiotic and try to see whether or not that actually helps them feel better. So when we do that, we actually call it empiric therapy. We give somebody a medication with the assumption or with the hypothesis that they might have a certain type of illness. And we try to see what happens as a result of giving them the medication, see if it helps them get better. In some ways, it's a form of experimentation, but if you were in that patient's shoes, you would probably want us to do the same thing, right? A lot of people do insist on getting antibiotics even without having a chest x-ray that actually diagnoses them with pneumonia. It would be hard for anyone to argue that any harm is intended in a scenario like that. And really, we can apply the same concept to any medical scenario. Anytime we prescribe any medication or perform any procedure, we don't know exactly how a patient is going to react to it because every patient is unique. But we do it anyway because we think that the possible benefits outweigh any potential harms. Now, some people would ask, well, what about clinical trials and studies? You're still experimenting on humans when you do those, right? Well, the answer is yes. As a matter of fact, no medication can make it to the market without being tested on human subjects. But would you take a medication that has never been tried on someone else to make sure that it's safe and effective? Probably not, right? Well, why not just test the medications on animals? Oh, wait, we don't want to harm or exploit the animals either, though, do we? I don't know. I lost track, but you probably wouldn't want to take a medication if it hasn't been tested on a human because humans are different than animals. Well, you know what? I bet there's probably some shady practices going on today, especially if the government has anything to do with it. Well, this day and age, in order for any clinical trial on human subjects to be approved, it has to go through a body called the Institutional Review Board. And they basically look for things to make sure that everything is ethical that's going on within the trial and that nobody is put at danger or at increased risk of harm. And as a matter of fact, that Institutional Review Board came to be in existence because of the cases that I mentioned before, or a situation similar to that, just to make sure things like that never really happen ever again. Now, having said all of that, not all consent that we get from patients is truly informed, especially when you're dealing with patients that have a low amount of health literacy. And also when there's financial incentives involved, you've seen those flyers where they're paying people $20, $50, $100 to be involved in studies. A lot of people jump at those opportunities to make that extra money without knowing exactly what they're getting into. And lastly, some medications like chemotherapy, for example, can undergo some pretty speedy clinical trials and be used in the hospital on patients with advanced illnesses without knowing exactly what the outcome will be. So one could argue that feelings of desperation and vulnerability can be taken advantage of in such a scenario. So should Black people just try to avoid experimentation at all costs? Please don't. Because in 2020, I can actually make the argument that Black people are not being experimented on enough. Let's use the example of prostate cancer screening. Back in 2012, the United States Preventive Services Task Force recommended against routinely screening all Black men with the PSA or prostate-specific antigen test to screen for prostate cancer. And they basically made this recommendation off of two studies that showed that PSA screening did not actually have any impact in terms of survival or mortality as it pertains to prostate cancer. But the only issue is that both of these studies that they were going off of, one of them was performed in Europe and the other one was performed in North America. But in both of these studies, Black men were heavily underrepresented. And that's a problem because Black men have 60% more cases than any other group, and we die at rates 2 to 3 times higher than Caucasians. So wouldn't you want some smart, intelligent researchers and doctors to actually try to do some studies specifically on us to see whether or not we would benefit from prostate cancer screening? I know I would. So in conclusion, don't allow the fear of being experimented on form a barrier between you and the care that you can receive from your doctor. If you don't understand something, don't be hesitant to ask questions. Be an advocate for yourself, your friends, and your family. I can't exactly speak for all doctors, but the overwhelming majority of us do have your best interests at heart. We've learned from history. But just understand that medicine is complicated and sometimes there's no way around trial and error. But bear with us and some amazing things can happen. Thank you for watching and peace out.